Right, I'm at ASIM 19, ASM, with new ASIM President, John Bonning. Congratulations, John.
Thank you very much, Amy.
To paraphrase from our esteemed Prime Minister here, who the bloody hell are you? We're really interested to know.
Who the bloody hell are you? Yeah.
You're the first New
have
Zealand...
an advertising campaign that said that as well. Where the bloody hell are you?
Scott Morrison, our Prime Minister, was the ad man behind that. So, you are the first New Zealand President of this college.
Yeah, look, it's an honour to be here. I'm from New Zealand. Grew up, mid-school there. An honour to be a Kiwi representing the college after 36 years of the history of the college, the first Kiwi, first New Zealander. And I've lived and worked in Australia as well, so I kind of know a little bit about both sides of the Tasman and really, really want to represent both sides of the Tasman, but celebrate my Kiwi heritage. It's an unbelievable honour on Sunday to have some representatives of the Tainui iwi come over and help envelop me with a korowai, a Māori feather cloak to help protect me moving forward. So the cultural significance was really emotional. So proud of my Kiwi heritage, want to work with both sides of the Tasman.
So tell us a little bit about yourself, John. What's your story?
Well, grew up in New Zealand, went straight from school to medical school because I couldn't think of anything better to do at the time, and then towards the end of medical school met my beautiful wife, who is from Sweden, and there's a long complicated story to that, but sliding door moments, and we met and hit it off, and that was 30 years ago. And we've been married for 26 years. We've got two beautiful children, and who are in their 20s, and so grown-ups and doing stuff. And I took a circuitous path into emergency medicine, didn't really quite know what I wanted to do, lacked mentorship at the time. I thought I was going to be a surgeon, and ultimately didn't fit in with that crowd, but still felt I had something to offer. And then I had some key mentors, Marjorie van der Paal, who's now past FACEM, who inspired me to do emergency medicine. I remember walking into her office the day after I'd had my last interview for surgical training, and is it, want to do it again, or Karen? And she welcomed me with open arms, said, we can make this work for you. So I went into Waikato Hospital emergency department and started training in emergency medicine, and have never looked back, and it's just been an amazing ride. So it was 15 years before I fully qualified as a fellow at FACEM, and then I've been a FACEM for 15 years now. So and just this meeting here has been utterly inspirational. The journey to get here has been phenomenal. So New Zealander, and it's kind of hard talking about yourself so much.
What was it about emergency medicine that just locked you in?
Look, I loved the decision-making intensity. I loved the speed of it. My wife suggests I have well-managed ADHD, and so I like to make decisions and move on, like to move rapidly. It's great to get some human connection. So I think I was just made for the rapid decision making, the chaotic environment, but getting sort of structure out of chaos that we get in emergency departments. And I loved doing a little bit of hands-on procedural stuff, and I still enjoy that, and I still do some surgical stuff and sew people up and enjoy that, but I also love the decision making and making clear decisions and moving, sort of segueing into what I want to stand for, sustainability across so many things, but sustainability of the healthcare system and making decisions to have patients not harmed by healthcare and find the really sick and injured ones and sort them out and look after them, but those that are not sick and injured, not do a million investigations, and choosing wisely I'm really, really passionate about. So sustainability, they can be looked at in many different ways in my mind, and these are things I'm really passionate about. So personal sustainability, so that we look after ourselves, we look after each other, compassion in healthcare. Professional sustainability of our profession to make sure we maintain our identity, do the right things for our patients, coming to conferences like this, you're just so empowered to see what people are doing in different areas, in the international scene and here in Australia and in New Zealand, and then of course sustainability of the planet. Something that's a big issue here. So sustainability is probably my number one thing that I want to stand for, and I've now been given a soapbox. My children and wife often say I carry a soapbox around, which I jump up onto to espouse things that I'm passionate about quite often. So I've been given a soapbox for the next 2 years. I have to be careful with that. I've just likened it to being strapped to the front of a very fast-moving train, and the train is got some really, really powerful and influential, important and great people on board with me. I need to represent them and need to make sure the train doesn't crash. But I've been the president for 3 days now and everything's whizzing by. So the things I want to stand for: sustainability, equity, and we can talk to that, diversity, that's another really important thing. So yeah, you get into this position and you do. I have serious impostor syndrome, that someone's going to tap me on the shoulder and say, the game's up. Because I'm just an ordinary person, really, very ordinary, and just came through, was tremendously privileged and lucky to get a good education, have a wonderful family, and have some wonderful support. I'm amazed that I've got here. I was very interested in kind of governance and influence and advocacy and influencing politicians, and I've kind of got to that stage in New Zealand, and then suddenly I've been given an Australasian even further afield. So yep, look, it's an amazing journey, and I'm excited and a little nervous.
What are you going to do with this newfound power that you wield?
Harness it very carefully, stop and take a breath. I've already been told, and I've got some wonderful mentors, including some really interesting, influential, powerful women in my life. I would name a couple of them: Dinah Edgerton-Warburton and Sue Irachi, who are keen to kind of help guide me, and I'm keen to seek their guidance around. So Sue was saying that I speak too fast. I have my brain is going very fast, and I speak very fast, and I have lots of words to say, but I've got to learn to speak slower, say fewer words to still get the message across. So it's still a journey, and obviously I've got some big shoes to fill in terms of Simon Judkins as the immediate past president, with the advocacy and the work that he's done, and I've described him as the everyman hero, just ordinary in the nicest sense of the word. Like I've said, that I'm an ordinary guy who's just got a passion and a touch for connecting with all levels of people. Patients, that's what we're really there for. Our colleagues, nurses, everybody that's influential, working in emergency departments. And he's described, we want to, what does the college do? The college trains and teaches junior doctors to become emergency physicians. It trains and teaches continuing professional development of emergency physicians, and now we've matured to the point of wanting to train and teach the public and the politicians around issues that we think are really important, like equity, like diversity, like climate change, like sustainability. So they're the big ticket items for me, and so that's my soapbox. I need to be careful with it, express the opinions of the people that I represent, do a lot of listening, and hopefully it's going to be a wonderful journey.
You hinted at something that is of policy interest, to yourself and the college. Just now, we were in a session about mass casualty events, and we heard about, the tragedy of Christchurch and Sri Lanka, and historically Port Arthur, yeah. And you said that the college feels very strongly, yourself personally, about
Indeed.
Gun control in New Zealand.
Yep. So we have submitted to the parliamentary bill on gun control. It's amazing. It took, how many days? It took 10 days in Tasmania. It's 8 months since the disaster in Christchurch. So we've advocated strongly for significantly tightening the laws on semi-automatic weapons, certain types of bullets, licensing the person, not just the weapon, just a whole lot of really sensible regulations. And, for goodness sake, pest control and shooting animals and what have you is an important issue, but these weapons can be used to kill people, and there is just no place for them in society. Do we want to become like America, where there are school shootings every day, hundreds and hundreds and hundreds of people? I think like tens of thousands, I believe, each year are murdered in America with guns. There's just no two questions about it. So we have submitted and have asked to be put in front of the Select Committee on Gun Control to talk about the impact that we've just seen in that last session. Real human lives cut short, and I think there's just no excuse for those weapons. We're not talking about banning things completely, but significantly tightening the regulations.
For emergency medicine in New Zealand, it's a small country and a small profession, group of people. What was the impact of Christchurch?
Yeah, look, it's one of those things where, and it was the same with the earthquake. Everybody kind of knows somebody that was impacted in some way. We have all been behind Christchurch. They had the small minor quake in 2010, then the big one in 2011, and it shook the country. And then with this terrorist act, the whole country, with just the outpouring of grief was amazing. Everybody had the crying Kiwi and a lot of stuff out on social media, and we were all just this was not us. That just wasn't us. And every single New Zealander stood up, and our Prime Minister just laudably and beautifully donned a hijab and was expressed the sympathy, we're very proud of our Prime Minister and what she stands for and acts like. We feel quite lucky to have that. So yeah, look, it was a horrible tragedy. I was just at a U2 concert a week or so ago, and their final song was One Love, during which they slowly put up the names of every single one of those Muslims who was tragically murdered. And it was a moving moment as well. So our country has been moved by this. It's not us, it's not what we're about, and so we want to vociferously and vigorously move towards being a better place.
And how about equity? I mean, you sort of talked about that quite a bit in your address yesterday.
Yeah.
What does it mean to you?
So equity, there's the cultural equity, I think I'll probably start off with, and there's the difference between equity and equality. So in New Zealand we have a strong drive towards gaining equity in healthcare outcomes for Māori, but I would in the same breath mention Aboriginal and Torres Strait Island people in Australia, but possibly also Pacifica people, both in New Zealand and in their home countries. So there's this thought that you treat everyone equally well. And a lot of people go to work wanting to treat everyone equally well, but you have to realise the difference between equality and equity is some people come from a significantly less privileged position and have less access to the determinants of good health, less access to education, less access to proper housing, and less access to healthcare. So we need to realise that some people, and you need to look, I've talked about the sustainability and choosing wisely lens. We need to look at choosing wisely with an equity lens to realise whilst you shouldn't be giving antibiotics to everybody with a sore throat, because the majority of them are going to be viral, rheumatic fever still exists in the Māori population, so you need to strongly consider and treat streptococcus infections to prevent rheumatic fever. So equity is about treating everyone with respect, and understanding their different worldview, it's quite hard to express this well, because I want to talk about the fact that we, and myself included, are privileged. And I think I prefer to sort of say that we're privileged and others are perhaps less so, as opposed to seemingly putting the blame on Māori for being in that position. It's not about that at all. In fact, we need to understand our privilege and realise that some people do need more care, do need more specialised care, and understanding what is important to them. And I use the quote, don't ask what's the matter with you, ask what matters to you, and understanding the culture. So for Māori, when you approach them in a cubicle in the emergency department, saying kia ora, and explicitly, that's a greeting to Māori, explicitly acknowledging every member of their whānau in the room, and that is very, very important to them. And so you do treat them slightly differently, although there's a lot of this that flows onto other aspects of your care, the compassion that you have for other people in the room and for the person and trying to connect with them. So equity for Māori, equity for Aboriginal Torres Strait Island people, for Pacifica people who come from a position of less less advantage is one of the critical things. And then, of course, there's the respect of diversity and gender equity. Specifically, we've started to address the gender inequity in governance positions on the college, for example, and got 3 wonderful and powerful women on the college board, which rectified a somewhat unforgivable situation of an all-male board. So we have a community representative who's got Aboriginal Torres Strait Island heritage, a young fellow who works up in Darwin, and a very experienced fellow from Melbourne, that bring this great cognitive diversity to the board. And really enriches our decision-making capacity to carry the college forward.
And finally, John, you're marching in the streets tomorrow.
Indeed.
It's look, Bob Brown said earlier this week, it's unprecedented, he believes, for a medical meeting to do such a thing.
Indeed.
So, can you tell me, what would you say to people who ask why?
So, climate change is a public health and population emergency. It is real. 98% of the world scientists agree that this is a real issue. You wouldn't get that number of the world scientists to agree that today's Wednesday. And it has real impact on the population, and particularly marginalised populations. Look at people in the Pacific nations that are going to lose their countries potentially with climate change. So we need to be aware of the issue, look at the significant weather events and their impact on our ability to deliver healthcare, the increased numbers of cyclones and severity of cyclones that hits the Pacific nations, the fires that are occurring here, made worse by climate change, threatening hospitals. There's going to be significantly more presentations to emergency departments. We want to advocate for more resources for emergency departments to deal with these. The number that I've heard is 250,000 extra deaths between 2030 and 2050 directly related to climate change, and for every death obviously there'll be significant casualties, heat illness particularly in the elderly, and so it's just really important. And then I can segue that back into the sustainability and elimination of waste in healthcare. Asthma inhalers deliver 3% of the carbon footprint of the NHS, the way they're delivered. So we need to treat asthma well, but we need to work out different ways of delivering that. Anaesthetic gases, and the amount of waste that's in healthcare contributes as well. So it's sort of a multi-pronged approach, and it's really important to us. People in emergency departments are going to be impacted, the population is going to be impacted. It's a public health emergency, and tomorrow we're going to declare a climate emergency.
Well, that's very exciting, and I have to finish this interview by showing everybody your shoes because they are absolutely phenomenal. Apparently John is famous for his shoes and his shirts. Look at those. Incredible. And look at this shirt. Bicycles.
And I'm passionate about cycling, if you want to know some other things
Oh,
about me.
really?
Cycling is my mindfulness. It's what I do to relax, and I love getting out on my mountain bike, preferably with friends or family, and so yeah, that's me.
And where are you based?
Based in Waikato in New Zealand, Hamilton. I'm back and forth across the Tasman. I bring my bike most times when I come back and forth across the Tasman, but want to connect with everybody around Australia as well. I was elected to this position, so a lot of people have shown faith in me, and that's a humbling experience. So represent New Zealand, represent Australia on a wider stage over the important issues.
All the very best for your presidency.
Thanks, Amy.
Thank you.